Blue light cystoscopy is a technique for detecting cancers in the bladder. Cystoscopy is just the normal way we inspect the bladder with a fibre optic telescope. And what blue light is it's a technique where we first put a special dye into the bladder, a substance called Hexvix, and that substance is taken up by the bladder and metabolized, but preferentially metabolized by the bladder cancer cells. We then use a special ultraviolet light, and that makes the cancers glow a pink color. So it makes it really easy to identify the cancers from normal bladder tissue. It's been around for quite a few years now, and we've found with this technique that we can detect probably 20% more cancers in the bladder. The reason we use blue light is because it really helps us find more cancers. And bladder cancer commonly can recur. People can have multiple cancers. Sometimes you can look in the bladder and see a cancer, but there's smaller ones that you might miss. So with this technique, it helps us to pick up more tumours, and then we can treat them more thoroughly and hopefully prevent the patients having to come back for more treatments and more operations. So with this technique, about an hour before the patient goes to have their cystoscopy, we put this medicine, it's called Hexvix, into the bladder. It's a liquid. We use a catheter, we put a tube into the bladder and run the fluid into the bladder. And then they need to hold that there for about an hour. And over that time, it's taken up by the tissue, and that's when the chemical process occurs to make the tumour glow when exposed to ultraviolet light. So there's a little bit more involved in terms of having to start a little bit earlier, and obviously need to have the catheter in the bladder and to hold onto this fluid for a period of time. When we do the cystoscopy, we pass a telescope into the bladder, and there's a switch, so you can switch between the conventional light, which gives you, it's brighter and you get more conventional detail, and then we hit the switch and it turns on the special ultraviolet light, and that makes the cancers glow. It helps us identify the cancers, but sometimes we switch between the two different modalities to, particularly when we're taking biopsies or removing the tumour, as it's a little bit easier to do the operative part of the procedure under white light. It's really very well tolerated. There are very few risks from this procedure. There's a very rare rate of allergy to the substance, but that's very rare indeed. In fact, it's really very well tolerated. And for most people, apart from the inconvenience of having to have the catheter and the medication, and a little bit more involved in organising because you've got to do an extra step to the case, it is very well tolerated indeed. Like many things in this world, there's an additional cost for the medicine, and there's special equipment, special telescopes that you need to do this equipment. They're not available everywhere, so not everybody has access to this. It's not also necessarily beneficial to every patient. There are some patients that are more likely to benefit, those patients who have multiple tumours in their bladder, those patients who have a type of tumour that's difficult to see. We call it carcinoma in situ. It's a flat tumour, and that's quite difficult to see under white light, so we really get a big benefit from using blue light. So if you've had a history of that, it can be useful. Blue light's a great technique, and there's no doubt that it increases the number of tumours that you can see. But that's not for all patients. Some patients only have solitary tumours, and it doesn't really make much difference at all. But I think, if you're in a centre where it's not available, and you can get more timely care with standard cystoscopy, well, then that's still a very good technique. And people should not delay their treatment if it's not immediately available to them.